Well, one thing parents don't realize is that a lot has changed in terms of the wisdom tooth world, if you will, the way that at least I specifically do things. I know when I had my wisdom teeth out, and I'm the age of a parent, things were much different than what they are now. Um, since I was responsible for myself and making the decisions and how they were done, I didn't have a parent to help me at that point. I chose to have the one wisdom tooth that was giving me trouble at the time. I was about 19 or 20. To have just the one tooth out and just go on with my life. Well, I went to an oral surgeon who is a professor at the local dental school. Obviously, he's well trained. He knows what he's doing. He suggested I go to sleep. And what does this 19-year-old do? Oh, no, I'm like every other older teen. I'm tough. I can do it. So we'll get that one tooth out, awake with local. Okay. An hour later, he finishes. And the problem he ran into, which I run into even with 19-year-olds, is that the tooth was fully formed. The roots had grown to their full length. There were four of those roots. They were all long, narrow, and curved, and they were surrounded by extremely dense bone. I was a cheese hound. I loved dairy. The bone was hard as rock, and it took an hour for that surgeon to get that tooth out. And the thing I remember, and keep in mind, I'm giving you this story, 50 years later? Do we have memories in dentistry? So the surgeon goes, "Okay, Ted, how you feeling?" And they hadn't finished yet. And I figured, well, if he's asking this question, maybe things aren't going quite so well. So at that point, I started feeling faint and realized that I would have been far better off to have been asleep for this procedure. Well, this story actually had a lot to do with how I, as an oral surgeon later, and I had no idea I was going into this, have made a lot of decisions to try to make the experience for your child far better than it was for me. And one of those, the steps is with anesthesia. At the time, people didn't want to do anesthesia because they're afraid of it. They're afraid they're going to get nauseated from it, which was common. Now with the anesthesia technique that I use, I haven't seen nausea in years. So that's a great improvement. The fear of anesthesia goes away in that I have much more control over my anesthetic than what they had 30 years ago, even when I was just starting practice. So I can control an anesthetic much better now than then. The medications I use, when I turn off the pumps to those medications, they're pretty much gone in 6 to 8 minutes. The typical narcotic that most surgeons use that you've heard of, fentanyl, that narcotic lasts for 60 minutes, which is 10 times longer. So if there's a need to make an adjustment in that narcotic, it's harder to do with a longer acting narcotic than with a shorter one. So there's two things that have really improved in terms of anesthesia. And if it came to having my child go to sleep, which actually I put my own kids to sleep to do their wisdom teeth, and they loved it. They had no argument at all in terms of how the procedure was. And, you're going to be a little nervous when your parent is operating on you, but there was no one else that I felt could do any better than I. And I trusted myself to get them what I wanted them to experience. And as now, they wake up in 10 minutes, no recovery issues in terms of nausea, no prolonged drowsiness, dizziness, any of that stuff. Basically it's like waking up from a nap. So when it comes to being a parent with a child, if you have any questions on anesthesia, you may want to see someone who has an expertise in anesthesia similar to what I just described to you.